name is Hannah. I'm a nurse here at the hospital. So, your doctor let me know that you've recently been diagnosed with diabetes.
Yeah, my name's Blaney, and this is my mom.
Hi, nice
Hello.
to meet you.
Yeah, I've just been diagnosed with type 2 diabetes, so.
Okay.
Yeah.
So, what do you know about diabetes?
Well, the doctor just told me a lot about my diet and,
Mhm.
like, giving myself insulin. And I know it's my body isn't able to regulate my, like, sugar by itself, so it can go, like, higher or lower.
Mm-hmm.
And that's pretty much it. I'm not anything healthcare, and neither is my mom,
Okay.
so we're kind of lost.
Right, yeah. Well, I'm here to answer any questions that you guys have, and I'm specifically coming in to teach you how to check your blood sugar yourself when you're no longer here with us at the hospital.
Mhm.
So first, I have this little handout to take with you, since I know this can be really overwhelming with a new diagnosis.
Is there a bunch of medical words on there? Because we're not going to understand them.
No, this is specifically written for people that do not have a medical background, and I'll go over it with you. So if you do have any questions with any other words, we can go ahead and write in another word so you can remember that later.
That's perfect.
Yeah. Is this a good environment for you guys that you feel like you can learn?
Yeah, it's nice and quiet.
Yeah.
And good lighting and everything?
Mhm.
So,
Yeah.
okay. All right, well, we can go ahead and get started. So we have your home glucometer check.
Before we start, I have a question.
Sure.
How often am I supposed to do this, or like why am I doing this?
Yeah, so you'll take your blood sugars, your test before every meal, and you want to do that so you know how many carbohydrates you can eat in your meal or snack.
Mm-hmm.
And so the doctor has given you a scale with your diet on how many carbohydrates you can have.
Mm-hmm.
And
Those
then-
papers with my insulin stuff.
Yeah, so that'll help you determine what you can have and where you're at before you eat, so you know how much insulin to give.
Okay.
So if her numbers are too high and she's still hungry, she can eat, just can't have the sugar stuff, like carbs.
You're gonna want things that have low numbers of carbohydrates in them.
Okay,
So something like meat or a different type of protein
gotcha.
would be low in carbohydrates. So we just have on here some ranges that you might want to know, since
Mhm.
you're getting a number and you're probably unfamiliar with
Right.
what
Yeah.
those numbers mean. So the normal range would be about 80 to 30, 130, I'm sorry. And a high level would be 180, so that would be pretty concerning. And then if it's over 300, you definitely want to go to the hospital and call your provider just so they know that you have gone in, because that is a very dangerous level.
Mm-hmm.
And then 70 or less would be pretty low.
Mhm.
So you'd be wanting to either taking some sugar pills that they have given you,
Mhm.
or just drinking something like orange juice, or eating something that's very sugary to help get your blood sugar back up. And so just a couple things about your levels. So if it's too high, it can make you have to go to the bathroom a lot, and you're gonna feel really thirsty, and it might make it hard to see.
Mm-hmm.
And you
I
might
think
get,
that's how they diagnosed me, because I was having all kinds of stuff
yeah.
going on. Mm-hmm.
yeah.
Yep.
Well, I'm glad that we figured that out so we can get
Yeah.
you feeling better.
Mhm.
And then if you did have low levels, you might feel dizzy, or you might sweat a lot.
Mm-hmm.
And so if you start feeling any of these types of ways, that might be a good idea then to do another check at
Mhm.
that time. So anytime you just feel a little bit off,
Mhm.
I would recommend doing another check, even if you aren't planning on eating, just to make
Okay.
sure that
Yeah.
it's good with that.
Mhm.
So do you have any questions about blood sugar levels?
No, I think this is good, as long as we can take that
Oh,
home.
Yes, and then we
Okay.
have the explanation on how to take your blood sugar on here, in case you want to reference that
Mhm.
again. But
Very
I'm going to
helpful.
go through it with you guys.
Perfect.
Awesome.
Yeah, so we'll just set this here. I'll give this to you. You can hold on to that.
Thank you.
And since I'm not taking my own blood sugar, I'm going to be wearing some gloves
Mhm.
just to keep you safe and myself safe.
Yeah.
And you make sure that you wash your hands beforehand.
Yes. I
Or
did.
you can use one of these alcohol swabs to wipe the area.
Okay.
And then we have a little tissue that you can use for the first part of the blood, but we'll get to that later.
Okay.
So in your little pouch, you have your glucometer, and so you're gonna press OK to turn it on,
Okay.
and wait for the screen. Then see it comes up as test.
Yep.
So you'll hit OK again. So then you want to get one of the test strips that comes out of here. And you want to make sure that the part that has the little blood drops,
Mhm.
that stays on the outside.
Okay.
So you can remember the blood drops is where you put the blood
Okay.
later.
Yeah.
So you just stick it into this little part down here.
Okay.
Insert it in. Alright. And so here's your needle.
Mhm.
So these numbers will show you how deep it'll go into your skin.
Mhm.
So since you are just diagnosed and haven't been sticking your finger a lot, we'll
Mhm.
go with a more shallow one.
Mhm.
But over time, your skin might get a little thicker from all those
Yeah.
pokes.
Yeah.
So you may need to go down to a deeper needle.
Okay.
But we're good right now with the 3, so you don't have to worry about that. We've got that ready.
Okay.
So do you have a finger that you would like me to prick?
Probably my middle finger.
Okay.
It's the toughest.
Sure.
Is it gonna hurt really bad?
No, it's just a little pinch.
Okay.
Yeah, so it doesn't take too long. And you just want to clean this off and make sure that nothing else touches it before you stick it.
Okay.
You're being really brave, dear.
Yeah, you're doing great. So then you want to stick this on here like that, and then you're going to push it in.
Okay.
And then you see a little bit of blood coming out.
Mhm.
So you may need to kind of milk your finger,
Okay.
push it down.
Okay.
So you have this first drop of blood.
Mhm.
You want to wipe that away
Okay.
to get a more accurate reading.
Okay.
So just keep pushing it until you get a drop about that big.
Okay.
So, Mom, do you see?
Mm-hmm.
All right, so yeah, that amount. And then you're gonna just put this to the side and watch the blood get onto the strip.
Okay.
So now,
It's okay. So it popped up. It said that my blood sugar is 125.
mhm.
Okay.
So then you just go ahead and
So that's a
wipe
good
it.
range because it's
mhm.
okay. Got
Yeah.
it.
And then you just hold a little pressure while you wait for the blood to clot. So just
Stop bleeding anymore. That didn't hurt at all.
and then you just
Throw
go
that
ahead
away.
and take this out, and you can throw this away.
Okay.
With this and everything, and then you can go ahead and have your snack or meal.
Okay. Perfect.
Oh, that's very simple.
I didn't
so
not too
simple.
hard.
This is very nice and easy to use, and I like the little case.
Yeah. What questions do you guys have for me?
You explained everything really well.
Mm.
Do you have any questions, dear?
No, I don't think so. Does it matter which finger I use, or just whatever?
No. Probably it'd be best to alternate different ones so you can kind of go down the line,
Mm-hmm.
just so one finger isn't getting pricked 3 or 4 times a day
Mhm.
every day.
Right.
But it doesn't matter. You can use any of them.
Okay. Well, I feel like that's probably about it.
Yeah, and if you guys have any more questions once you guys go home, you're welcome to call us back and we can walk you through it again or give you more information.
Okay.
Thank you
so much. This is so helpful.
You're welcome.
We started out with making sure that our patient was in a very learnable environment, making sure that it was calm, quiet. That way they could really attain all the information that they were given. Since this patient was newly diagnosed, we know that this can be a very overwhelming condition for them, and they're really thrown everything all at once. So we wanted to make sure that they were in the proper environment to really achieve all of that knowledge. We next went through with their health literacy by providing this handout that they could take home and reference at later points if they were confused or needed any clarification. We made sure to go through every single step of this handout to make sure no further explanation was needed, and we made sure to ask questions about any words that they were unfamiliar with. That way we could provide further education or a different word that they might be more familiar with. this can be really tailored to any part or cultural or anything like that. For example, if our patient had a language barrier and didn't speak the language that we have, we could provide a translator. That way the knowledge is really obtained and thoroughly met. And it can be tailored to like age ranges. So if our patient was an infant, we would tailor the teaching more to the parent since they would be doing the majority of the care. Or if it was an adolescent like our patient was, we made sure to teach her and the parent. That way, if the child didn't really understand it, the parent was also there to give guidance and also have that knowledge as well. And for any of our older patients that are either in an assisted living care or their children take care of them, we can make sure to teach their support system as well, because it's always important to have that support system since this is such a life-changing condition for many people. We could also work closely with their healthcare providers to implement any other techniques or strategies or devices that would fit their lifestyles better. For example, like toddlers or people that live a really active lifestyle like many adolescents, they could be beneficial to have a Dexcom or an attachment device where you don't have to be pricking your finger 24/7, or if you don't have the supplies or anything like that, economically, those could be better options. So it'd be very beneficial to view our patient's life fully so we can give them the best care.